Hello, and welcome to this presentation on substance abuse. Today, our topic will be specifically about abuse of alcohol and the resulting conditions of alcohol use disorder, as known as AUD. In this presentation, we will be going over the ins and outs of alcohol abuse. We will be starting with a quick discussion of alcohol and its history of abuse. Then we will move on to its prevalence and epidemiology, risk factors, and vulnerable populations. We will look at short and long-term side effects as well as the signs of symptoms of abuse upon assessment. Overdose potential and suicide will be considered. Then we will give an example of patient care plans. Finally, we will be ending with our conclusions. Alcoholic beverages are endemic in the society. They consist of water, alcohol, and can taste tremendously different according to the type. Obviously, beer tastes different from wine, which tastes different from spirits such as vodka, bourbon, gin, or many others. These beverages can be made from many different agricultural substances, given that to make alcohol, one basically needs just some sort of sugar can be converted through the fermentation with yeast and ethanol. Alcohol is one of the world's oldest drugs, which research is finding science and even recipe for alcohol going back to very dawn of civilization. In fact, many academics believe that early civilization arose out of agriculture. Originally, it was assumed that early agriculture efforts are that what allowed for the production of alcohol. However, many now believe that early agricultural communities were formed specifically so that alcohol could be produced. It is important to note that alcohol does have other uses such as medicinal and industrial. Regardless, it is indisputable that alcohol is a drug that has been with society since the very inception of civilization. Just as alcohol goes back to the earliest time of civilization, so does its abuse. Bacchus was the Roman god of agriculture and alcohol, but he was also a god of ecstasy and fertility. In the very first book of the Bible, Lot is gotten drunk so then he can be taken sexually advantage of. Abuse has continued through the history. In fact, the abuse of alcohol was considered so severe that the US even attempted complete prohibition of it, which became effective in 1920. However, this effort proved unsuccessful as the ending of prohibition showed. Currently, alcohol abuse is a major problem, and according to the World Health Organization, it represents 5.1% of the world's health burden. In fact, over 3 million deaths occurs each year globally due to alcohol. Beyond the physical problems that can be due to health conditions and injury or accidents, there are also a litany of mental and behavioral ailments. Importantly, there are also economic and social losses, as those who abuse alcohol neglect their jobs as well. In 2021, in this country, 18.6 million adults, or 11.3%, have had alcohol use disorder. This includes 13.2% of men and 9.5% of women. This also includes nearly 17% of Native Americans, over 13% of Pacific Islanders, and between 11 and 12% of white, black, and Latino Americans. Asian Americans rates are over 6%. Children are also affected, with approximately 894,000 of those from 12 to 17 years old having had AUD within the past year. Although rate are higher for girls at 4.7% than boys at 2.2% among this young population. Total cost of alcohol use disorder is $249 billion annually. Binge drinking is actually a majority of the excessive use of alcohol. And here one can see a map courtesy of the CDC that outlines prevalence of binge drinking by state. While some groups are more at risk to alcohol use disorder than others, it is important to note that there is a condition that can be found in virtually any U.S. population. Over 90% of the U.S. population will drink at some point of their life. Some groups are more at risk though, which will be discussed here. Genetics are an important risk factor. The more relatives a patient has with an alcohol use disorder, the closer they are related, and the more severe those relatives' problems are, then the greater the chance a person will themselves develop an AUD. Those who drink frequently or in large quantities are at elevated risk. Those with mental health problems tend to be at significantly higher risk. And in fact, 30% of psychiatric patients also have AUD. Those who live in areas or among those that frequently drink and who approve of alcohol are used at the higher risk. For example, Utah is known as the state with the low level of AUD, but it's also a state where the majority of population is on Mormon faith. Those adherents are not allowed to consume alcohol. We have already seen how certain groups, such as adult males and Native Americans, are also at higher risk than average. There is a short-term side effects of alcohol use as increased feelings of relaxation as well as decreased anxiety. However, our focus is on the negative side effects. A person that is living minimal alcohol consumption does not suffer from AUD, and as such is not the focus on this presentation. On the short-term basis, the side effects will become more severe as blood alcohol concentration increases. And here one can see how the effects become more severe as BAC increases. At first, motor performance is merely slowed and thinking ability modestly impacted. But as the BAC increases, the motor performance gets worse and cognitive abilities decline more. At extreme levels of BAC, it's even possible for death to occur. The long-term effects of alcohol consumption can also lead to death or other medical impairment. Once a patient has consumed large amount of alcohol over time, the odds of many conditions will increase. Many cancer types become more likely, liver disease increases, heart diseases increases, GI problems, and many other conditions also increase in likelihood. If patient seems to be at high risk for AUD, then they should be screened for alcohol use using a screening tool such as the CAGE tool. Some signs that a practitioner can use to consider it if patient has AUD include drinking excessively, all alone or unable to control, being distraught when asked about drinking habits, neglecting personal hygiene, work, school, etc., still drinking when problems from drinking arise, and having alcohol cravings, withdrawal symptoms when not drinking, like tremors and memory lapses from blackouts. It is also important to note that many issues such as liver damage are often due to alcohol, and so screening may be appropriate. Laboratory results can also be helpful. AUD sufferers will tend to have high results on the following tests: GGT higher than 0.35, CGT higher than 3%, MCV higher than 91, and AST and ALT higher than 45. Test results concerning common alcohol-related illness can also be useful, such as AST levels. For example, if liver function tests are poor, then it could be represent signs of excessive alcohol use. Overdose deaths from alcohol require very large amount, but are typically not seen until BAC level exceeds 300. It should be noted that the heavy drinkers can develop such a heavy dependence that they can die from withdrawal symptoms. As such, severe AUD cases require special treatment consideration, as we will discuss later. While alcohol is not used to specifically commit suicide, it is a factor and consideration. Decreased inhibitions and reduced judgments are side effects of alcohol, and so this can increase the likelihood of suicide. Studies have indicated that alcohol use often precipitates suicidal behavior. Before we discuss the treatment plan, we need to discuss the potential severity of alcohol withdrawal. It can be a fatal condition once the patient reaches a state of delirium tremens. In the vast majority of cases, alcohol is not life-threatening, but it still can be a very uncomfortable process. Common symptoms include anxiety, depression, fatigue, irritability, mood swings, and more. More advanced symptoms can include nausea, pallor, rapid heart rate, insomnia, headaches, clammy skin, tremors, and more. Severe symptoms can include extreme agitation, delirium, fever, and even seizures and hallucinations. Patient care plans will vary depending upon severity on the patient condition. For example, a patient may present with sleep problems which end up being due to milder case of AUD, where they are consuming 5 beverages in the evening. That patient may be able to be treated through the patient's education, perhaps some therapy to help them deal with distress using non-alcoholic means, and then instructions to cut back on the amount of alcohol that they are consuming. A moderate case of AUD may require more assistance as there will be more severe withdrawal symptoms. Medications such as benzodiazepines or carbamazepine may be needed. The patient will need to have a calorie-heavy diet that includes vitamins, especially thiamine. Severe withdrawal may require intravenous medications. Therapy will be recommended, and patients should have social support as well. Organizations such as Alcoholics Anonymous can be utilized. There will be need to be follow-up to ensure that the patient stays the course and avoids relapse. Alcohol is a powerful drug that has been with us since the inception of civilization. Alcohol use disorder is a tremendous burden medically, socially, and economically. AUD is widespread and needs to be addressed. Patients suffering from AUD need to be screened for key symptoms so that they can be treated. Treatment will vary according to severity of condition, but will require interventions, detoxification, and then rehabilitation. Are there any questions or concerns from the audience? And thank you for listening.